Following increased scrutiny and pressure, Pete Buttigieg released a list of the clients he worked for during his time at McKinsey, and one of those clients was Blue Cross Blue Shield. According to the South Bend, Indiana mayor, his responsibilities involved on-the-job training to develop skills in the use of spreadsheets and presentation software. But before Buttigieg released this list, there was speculation about who some of his clients were. Former healthcare executive and leader of the Medicare for All, now PAC, Wendell Potter, actually predicted that Blue Cross Blue Shield would be on that list, tweeting, "Pete is fighting to preserve the role and profits of health insurance companies. I'll be watching to see if my former colleagues send him big campaign checks." Wendell joins us now via Skype to expand on all of this. Welcome back to Rising, sir.
Thank you, Crystal.
All right, so you accurately predicted this based on some of the clues and breadcrumbs we had about Pete's time at McKinsey before he even put out the list. Just talk to us about how you were able to figure out where he was working and what he was likely working on.
Well, I spent 20 years inside the health insurance industry, so I know the industry pretty well, and I knew that Michigan has a very large so-called nonprofit health insurance company. When I saw the way he wrote it, it seemed like he was purposely trying to make it seem pretty benign, that his work there was not all that significant. He mentioned a nonprofit health insurer, and one might think that nonprofits operate somewhat differently from for-profits. They don't really. But I know that Blue Cross Blue Shield of Michigan is by far the biggest health insurance company in the state. And I just began to look around to see what was going on in 2007. In Michigan and at that health plan in particular. And I saw that it probably would have brought in McKinsey or a consulting company around that time because it wasn't as profitable as the company wanted to be. And lo and behold, I found that not too long after that, the company laid off 1,000 employees and really jacked up premiums on its policyholders, over 20% in many cases. So I just was saying, if this is the case, we really need to know more about, we really need, for the candidate to release the name and provide more details about what exactly he and his team, by the way, not just him, but what his team did at McKinsey for the client and what the recommendations were and what the client did as a consequence.
And based on your long history in the industry, what are the types of practices that health insurers will engage in when they are seeking to up their profitability?
They really try to restrict utilization. They have two ways that they do this, and McKinsey in particular is noted for looking at two different areas. One is to increase revenue, and another is to decrease cost. And it seems as if Blue Cross Blue Shield of Michigan followed both paths. Well, they did actually. One of the recommendations typically is to lay people off. They'll look at the workforce and make recommendations where they think the company can get by with fewer employees. And I can speak from personal experience because my old company brought in McKinsey, actually had McKinsey on retainer. And more often, more than once, I was having to lay people off in even my own department as a result of recommendations from McKinsey. The other, as I mentioned, is to increase revenue. And that can take many different shapes. But for a health insurance company, it usually involves increasing the cost of health insurance to their customers, whether we're talking about individual customers or their business customers. And that's absolutely, according to published reports, exactly what Blue Cross Blue Shield of Michigan did. And it's what companies, nonprofit and for-profit alike, have been doing over the last several years, including since the Affordable Care Act was passed. This was before, his time there was before the Affordable Care Act was passed. But even since then, we've seen the same thing going on as more and more insurance companies are just jacking up rates. And it's costing a lot of, the result is that a lot of people are now dropping their insurance that had gained it through the ACA. And increasingly, people are not even taking up the offer of coverage to the workplace because of ever-rising health insurance costs.
Yeah. Well, Pete's response to the idea that he may have been involved in layoffs was to say that, for those who support Medicare for All, that would mean laying off essentially everybody who works in the health insurance industry. As someone who supports Medicare for All, what's your response to that?
Well, it's very disingenuous. And it also indicates that he just has very little understanding or is trying to mislead us on that. Insurance companies have grown very, very large. Even insurance companies like Blue Cross of Michigan have for-profit subsidiaries. And a lot of these companies have profit centers that have nothing to do with selling health insurance. They've become big and very profitable. The fastest growing and most profitable division of United Healthcare, for example, is a division called Optum that doesn't sell health insurance. These companies will not dry up and blow away. The other thing that is very important to know is that these insurance companies over the years have hired tens of thousands of nurses. United alone has hired more than 10,000 nurses. And in many cases, the role that they play are called denial nurses. They're the ones who are at the front lines of denying coverage for a treatment that your doctor might recommend. And they employ a lot of doctors as well, too. These are people who are skilled. They can go back into the workforce. And the other thing that he didn't mention, and I think purposely trying to obscure, is that in the Sanders bill and in the House bill sponsored by Congresswoman Pramila Jayapal, there is a provision that would set aside a lot of money, actually, to retrain people whose jobs would be eliminated in the health insurance industry, and give these people, help train them to be in jobs that actually would be more productive and better for society than denial nurses.
Yeah, so rather than denying care, they could actually go back into providing care. Imagine that.
Exactly.
Help voters understand. I mean, how should they consider Pete's time at Blue Cross Blue Shield in Michigan and how that informs his healthcare views today?
I think it's very important to take that into consideration because he had to get some visibility into how that company operates. If he was reviewing if he's doing spreadsheets and reviewing data and working in the team that was brought in, he has to know how insurance companies operate, or at least have some understanding of it. And we're also seeing that he clearly is that thing that just what we just talked about, eliminating health insurance jobs. It's also clear that he is being influenced by the health insurance industry's talking points. In my old job in the industry, I used to play the jobs card too. And I call it that because every time reform is proposed that insurance companies don't like, they say, oh, they'll have to lay people off. It's called playing the jobs card. And he's doing that. He's absolutely using the talking points that I used to create in my old job, and my colleagues in the industry, or former colleagues, are still turning out.
Yeah, must be stunning for you to see that direct relationship and recitation of the points that you were part of pioneering. Wendell, thank you so much. It's always great to have your perspective.
Thank you, Crystal.
We'll have more Rising for you after this.